Health headlines: how vitamin D3 may help your heart. A common household chemical is now linked to liver disease and cancer, and what to know about the recent formula recall.
Joining us this morning, Dr. F. Perry Wilson here, Associate Professor at Yale School of Medicine, Yale Medicine physician, and author of How Medicine Works and When It Doesn't. First of all, Doctor, good morning. Thank you so much for your time.
Sure, happy to be here.
We were just talking in the break about vitamin D3. A new study found that individualized vitamin D3 treatment for people who have had a heart attack can actually reduce their risk of having another. This is interesting. Can you tell us about this?
It sure is hot off the press from the American Heart Association annual meeting last week. This was a study of 600 people who had had a heart attack. 300 of them got targeted vitamin D therapy and 300 got placebo. And those who got vitamin D had a halving of the risk, as you pointed out, of heart attack in the future. Now, what's strange is that we've tried this before, and vitamin D supplementation hasn't reduced the heart attack. What was different about this trial is that they measured vitamin D levels in the participants as they were giving them the doses and made sure that they hit a target level. And that, it turned out, required in some cases quite a bit higher doses than what you would normally get from the supplement aisle. And I think that's the special sauce here. But be careful if you hear about this. This doesn't mean go out and overdose yourself on vitamin D. That can cause problems. It can cause kidney stones, among other issues. So you really want to do this under the supervision of a doctor.
Doctor, this is troubling because we all do work and cleaning around the house. The chemical used in many household products has been found to triple the risk of liver fibrosis. What is this chemical? What can you tell us about it?
Yeah, this is a chemical called tetrachloroethylene, but it's sometimes abbreviated confusingly as PCE. It's a common dry cleaning chemical. Actually, that's probably who's at highest risk here of having significant exposures, people who work with dry cleaning, but it can off-gas from your dry cleaned clothes for some time. A new study that looked at a representative population of Americans found that 7% of them had elevated levels of PCE in their blood, and those people that did had 3 times the risk of liver fibrosis, which is something we see in people, who have excessive alcohol intake typically, or maybe hepatitis or obesity. But this is clearly a new risk factor. Some good news, the FDA is phasing out the use of this chemical, but that is over the next 10 years. So there's still going to be some risk. You can find pretty easily online what household products contain PCE.
Okay, and ByHeart Formula recently had a recall. Can you help us through this? What should parents do if the formula they use has been recalled?
Well, immediately stop using it. This recall was due to 17 or 18 cases of botulism in infants. This is a bacteria that leads to paralysis and can even cause death because the infants stop being able to breathe. And so this formula can be returned. You will get a refund. You can use a different brand. Stores have already pulled it from the shelves. What you should know, though, is if you're feeding your baby any type of formula or anything, and they start to appear weak, they're not moving as much, they seem somewhat more flaccid than normal, that can be a medical emergency, and you want to seek help right away because time is of the essence in those situations.
All right, doctor, just one more thing for new parents to worry about, right?
Right.
Well, we live in the modern world, unfortunately.
It's part of it.
Doctor, thank you so much for your time today.